The new piece.
Up to the fair. Hi, welcome. This is the Good Samaritan Network Resource Fair, and each year we hold this on the usually
May, anywhere from March to May. It depends on what they decide, the agencies.
I'm speaking with Nancy Chance. She's the founder of Good Samaritan Network, an amazing lady who has so many interesting things to talk about. We're going to talk a little bit to her, and then we're going to walk around to the tables and talk to the different people that are here representing businesses and charities, all different types of people here, from food banks to Coats for Kids, all different types of wonderful organizations that are here. So we're going to learn a little bit about them today, so maybe they could be of benefit to you. But if you're watching this right now, we will be here until 4 p.m. today. So we would love it if you come down and see us. We're at the Hamilton County Fairground Building, which is at
2003 Pleasant Street, Noblesville, Indiana.
Wonderful. And Nancy Chance began Good Samaritan Network in
1980.
Wow, 1980. And this fair
10 years ago. This is our 10th annual.
Wonderful. And it's an amazing amount of vendors and people that attend the fair, usually about 100 vendors, and then the attendance keeps growing every year.
Yeah.
And there are different pieces to this fair that Nancy has added over the years. The volunteer connection is a wonderful piece.
Yeah, there's several booths that have volunteer opportunities for people looking for volunteerism, for young people as well as themselves, older people or families, and that connection really is a big support for the community too.
It's wonderful. And the caregiver connection.
Yeah, they've still got the caregiver connection. There's a lot of senior programs that are supporting seniors in Hamilton County, and that is a perfect way of finding out information that you might want to find out more about than having a phone call with them. You may actually want to come and buy or get some of their brochures and actually communicate with the people that are actually doing the work.
Yes, and lots of great. And is that in a separate section?
No, we're blending it in
It's
because
blended
we
in.
felt like it was better blended in. They've decided to do that this year.
Okay.
So.
And the color of the balloons at the tables designate?
The blue are the not-for-profits, the orange are government entities, the yellow stars are sponsors this year, the red is food programs, the white is free clinics, and some of them have programs that you can get testing and things like that. And then we have the green balloons, which are companies, but companies supporting like seniors or other entities that actually dovetail off of what not-for-profits do. And then we have, I think that's it. I think I said the red and the green and the yellow and the white and the orange. Yeah, I think I got them all.
Wonderful, wonderful. So please come on down if you have some time. Come on, you have plenty of time. Come on down and visit us, and come meet Nancy. Stop by and meet her. She is an amazing woman. And we'll talk to Nancy at the end of this.
Agencies are amazing people.
Yes, that's true.
That's it. Agencies and pantries. We have 43 pantries and over 268 agencies in Hamilton County and in connected counties that actually work with us on different programs.
Wow.
But we don't have any duplication of service for Hamilton County.
And that is because?
We started out doing it that way because we felt like it would be donor confusion if you were donating money. It also is client confusion. If you're trying to decide where to go for help, you need to know exactly where you're going, and it made the community not-for-profits that we have more robust. Their programs develop bigger and better and deeper due to the fact there's not a lot of duplication at all, except pantries. They duplicate what they're doing, but not in the same areas.
Nancy is very modest. The reason that works is because Nancy got all the pieces, all the volunteer groups together in Hamilton County and networks. And they have a networking meeting every month, and that is what keeps all of this running so well. Nancy put this model together, and it was innovative, right? This model didn't exist.
It was back in 1993, and we did it before it got big and explosive in Hamilton County. That's why we've intentionally worked towards non-duplication, so it keeps down confusion, but also collaboration. And we meet the second Tuesday of every month, 3:45 to 5 o'clock here at the Hamilton County Annex Building for our meetings, and all of our meetings are with agencies, pantries, or anybody in the community that wants to come. Churches, or clubs, organizations that are wanting to dovetail into the network are welcome, so that they can have work groups or community groups or do collaborative action with some of the agencies to help better the agency. So it's kind of creative. We've also started the Hamilton County program for executive directors, and that is the third Tuesday of every month, and we've been doing that for about a little over 2 years.
And what is that?
And executive directors get together on a different level. Executive directors need to have a sounding board or a communication mechanism that is not part of other people, so you can kind of talk about policies and procedures and maybe board structure and things like that you want to dovetail with communication with somebody that's already done something like that. And then that way you build a stronger collaborative with the EDs.
Wow.
So that's really going well.
Yeah. So you adjusted it to make it even better. You keep adjusting. There's a lot of it. The ideas come from the internal mechanism of all of our people. We communicate with them, and they communicate with us. Do this, do that. That's one suggestion, and we just are really fluid about making those changes so that we can accommodate those agencies and pantries. Amazing, amazing.
It's an amazing program, but it's all amazing people doing this.
Mm-hmm. Starting with Nancy. She's too modest. Thank you. Can we talk again at the end? We'll just kind of wrap it up.
You want to talk about Good Samaritan real quick?
I would love to talk about Good Samaritan.
Good Samaritan has got six agencies that we're physical agents over, and that is the Partnership for Healthy Hamilton County, which is a 5-hospital coalition. They're in the process of getting their 501c3, so we're excited to see them go out of the program and be independent and doing their program too, and we're excited about that. We have the EAT program, which you're going to hear about here in a few minutes, energy assistance, that we're under Area 4, collaborating with them, subcontracting to do Hamilton County for energy assistance, and that's gone very well this year. And then we also have the Rehab Link, which is the hospital beds, Hoyer lifts, wheelchairs, all kinds of support aids for free, and that's located at 865 Westfield Road in Noblesville. And you call for an appointment, and you'll hear about that on down the way too. So. And then we have Recycle Cycles, which is the bicycle program that we have, and we do over 500 bicycle repairs a year, and we actually give those bicycles away to some homeless, some people needing transportation to jobs, and children. And so we're real proud of that program. It's retired executives that are working together. Their hobby was bicycles, so they wanted to do something in the spare time on, their downtime, and so they are now refurbishing bicycles, and that's in Westfield. We have 1,900 square feet in Westfield, and we're doing that on a daily basis. So it's a lot of exciting things going on, and we have the Cancer Fund, and that's in our office where we help families that need cancer support.
And what about the Thanksgiving event?
Oh, well, we do Thanksgiving and Christmas. That's part of our normal program, Thanksgiving and Christmas, to all the families in Hamilton County at risk, the seniors, in support of all their needs. And it's not a matter of needing something. It may be that they don't have any place to go, they don't have any family, maybe they're homebound, and they just need that extra assistance. And we work with Meals on Wheels and Prime Life and the Shepherd Center to make that happen, because their clients are the ones that we actually service too that day. That way their volunteers get a day off, and we can actually get the food to them for that weekend. And then we do it on Christmas Eve too.
So
You can hear when Nancy's talking how everybody does work together. I
Yeah,
mean,
it's
just how she's
collaboration.
mentioned all these names. It
Yeah.
just shows how all these different pieces do work together. So, what about volunteers?
Volunteers.
What's your need?
My need. Well, we have a volunteer opportunity on our website all the time, daily, and then also special events. And if you sign up there, then you actually do get a communication through an email. And if you don't want to come that time, you're not interested, or you're gone, or you're having another something to do like a vacation, that's okay. But you can just sign up whenever it's available for you and your family, and you can come out and help us.
Yes, it's wonderful.
It is.
It's a great organization to volunteer with. You feel amazing when you're helping, and you're very valued when you come and work with this group. They value everybody from whatever job that you can offer. They're grateful to you.
Yes,
Really
we're very
grateful.
grateful for all of our volunteers. If it wasn't for volunteers, we couldn't do what we do.
And when I do the events, I see the same people every year at the same events because they just put it on their schedule for Thanksgiving or the Christmas one or whatever. They bring their kids, and they're teaching their children. They'll do families that volunteer together, or school groups. I know that the school groups come in. Could be even the young ones.
Oh yeah, we have a school group for Fishers Junior High walked their kids to us today, and they did service hours for 3 hours this morning, and they're walking to Dairy Queen to eat lunch and going back to the school. So we have all kinds. And then we have a senior program that came, and they bussed the older ladies to us, and they took off tags and things like that from our consignment fairs, and they had a ball. So we have all kinds of ages.
Yes. It's amazing, amazing. Thank you, Nancy.
Thank you.
And we'll talk again.
Thank you.
Before the end of the day. Do you want to walk this way, and we'll kind of go on to our next?
All right, guys, heads up. You're being interviewed.
Hi. So who do we have you here in your name?
Vicki Densham.
Okay, and Vicki, what do you do?
We do the Energy Assistance Program. We started it this year for Hamilton County. So it assisted people with low income with their electric and gas bills.
Okay, and if somebody has the need for, they're having trouble paying their gas bill, electric bill, they're having trouble paying that, how do they go about getting your help? What's the best way?
They go to our website, and the application and everything needed is right there on our website. Very easy. Or you can come here today, and I have that.
Yes, come here. What is your website?
It's gsnlive.org.
Wonderful, wonderful. Do you use any volunteers in your group? No? Okay. I just wanted you to be able to give a plug if you needed some volunteers. A good way to get volunteers, right? People might be listening. Well, thank you so much. Are you also with the Energy Network?
I am.
Okay.
My name is Mary Kohler, and I work with Vicki. Her and I do the Energy Assistant Program. Yes.
Well, thank you so much.
Absolutely. Thank you.
Have a good day, you guys. Good luck. I hope you have lots of visitors. Hi. Yes. Hi. Good. I'm Christine Tennant.
Hi, Christine Tennant. I think I've heard your name before. Probably. I'm Joan Moniger with Breathe Easy Hamilton County, and we are here helping to help people quit smoking in Hamilton County, promoting a smoke-free Hamilton County, talking about the dangers of vaping and e-cigarettes, trying to hook people up with the 1-800-QUIT-NOW free tobacco quit line, cessation programs, helping employers and medical providers get into that system too so they can refer patients to the free quit line, and just doing everything that we can to help have a healthier county and a healthier population.
Yeah, it sounds like you are reaching out in a lot of different areas.
We are reaching out in a lot of different areas, yes, and we have the support of TPC through the Indiana State Department of Health. And
Tell me what TPC stands for.
It's the Tobacco Prevention Coalition. Okay, and you can go on to the Department of Health's website and go under tobacco cessation and find out all about them and kind of the larger work plans they have for Indiana as a whole. Indiana is part of Tobacco Nation, which is 12 states that have a extremely high percentage of smokers in the population, and so we are working really hard to reduce that and get us out of the tobacco nation.
It's wonderful, wonderful. Do you use any volunteers in your group?
We particularly use some youth volunteers in the summer because we're out at a lot of different events, and anyone interested should contact Stacy London, who is our program coordinator, and she will help hook them into how to volunteer for us.
Would that be through your website, the best way?
You can also do that, yeah, through the website, which you can go in under Breathe Easy Hamilton County or through the Good Samaritan Network, because we are a part of we are linked into, we are part of the Good Samaritan Network, and Nancy, who you were speaking to earlier.
Wonderful. It's so wonderful. This is great. Thank you so much.
All right, thank you.
Thank you. Working our way down. Oh. Hi. And your name?
Joanne Hogle with America's Drug Card.
Oh, wonderful. Can you tell us a little bit about your organization?
We have discount prescription cards and mail-in order cards to help people find discounts on their medications through our website. They can go on and look up their meds and figure out which pharmacy is going to have the deepest discount.
So what would the process be? Are these over the counter as well, or are these prescriptive? Just prescription. Okay.
Yes.
And I know that they can be very expensive. So somebody, what's their first step? Let's say they have that prescription ready to fill, but they can't afford it. What would be their first step?
They would just take out a discount prescription card into the pharmacy of their choice and present that to the pharmacist and receive a discount. If they really, really are looking to narrow it down, maybe they have a few medications and they're expensive, they can go on the website and price their medications from the different pharmacies and find which pharmacy is giving the deepest discount. Yeah.
It's wonderful. So I see USA Pet Meds. Interesting.
Program. So pets need medication too. So they can do the same thing. They can take a card into the pharmacy if it's a people medicine and present the card and receive a discount. Or if they're on pet medications, they can go to the website and get their pet medications from there.
Okay, and when you say you use this card, are you saying that all they need to do is take this card without registering or anything?
Yep.
That's all they need to do?
Use it over and over again.
Okay. And so does the pharmacy charge back to your organization?
No.
They just give a reduced amount, but they don't have to do anything to qualify?
No.
Oh.
Free to the public. Anybody can use the card. Even if you have insurance, you may have a really high copay, and if you have a prescription that is, $12 with the card, or even $20, and you have a $100 copay, it makes sense to just use the card and save. So all consumers do deserve to have the same information, and whether you have insurance or not, to use the card.
Okay.
So, and we even have a new mail-in prescription for brand names, which are so expensive. Our Metaphor Global and brand names are very expensive, and they can really get the brand names at discount prices through the mail-in.
This is wonderful. I have never heard of this. This is fantastic.
Thank you so much.
Well, good luck today. I hope you reach a lot of people. This is amazing.
Thank you.
Thank you. Moving on. Hi, would you like to talk with us? Sure. Oh, wonderful. Your name?
My name is Anna Kaiser, and I'm from the Trinity Free Clinic.
Wonderful, wonderful. Where is the Trinity Free Clinic located?
So the Trinity Free Clinic is located in Carmel on 146 in Oak Ridge. It's technically on the campus of Our Lady of Mount Carmel, if people know where that is.
Okay. And what kind of services do you?
Free medical and dental care to all of Hamilton County residents that are uninsured, underinsured, or low income.
Wonderful. And how do they go about qualifying?
So they need to call the clinic and say they have to verify where they live, so we only serve Hamilton County residents. We need to see photo ID, and we also need to see records of their bank statements and pay stubs to make sure they qualify as the low-income residents of Hamilton County.
Okay. And let's say there was someone who just came down with an awful toothache. How quickly could they register and get in to see a dentist? If it happened today, how soon could they get into a dentist?
So it all depends on when we have our dental clinics. So we do have dental clinics every Saturday and 2 days a week and sometimes 3 days a week. Wow. So fairly quickly. Now if they came in, we're not open on Sundays, and it just depends when we have providers, but we usually have a very quick turnaround because we know when people are in pain or need help, they need it right away. So we do our best to get people that are in those extreme pain situations and as soon as possible.
Wonderful. And the medical works the same way?
Yes.
Once a week as well?
So actually during the week we have a lot of different type of medical clinics. So we have everything from pediatrics to vision to acute care. So our acute care we have 3 times a week plus our Saturday, and we offer that in the mornings, evenings, and afternoons. Not every day, it's on different days of the week to serve those who work at different types of hours.
And so can they walk into the acute and then get qualified right then and there, or do they have to do that ahead of time?
So Saturdays, total walk-in clinic. So from 8 to noon, you register, you come in, total walk-in clinic. During the week, it is appointment only. There is that occasion where we will have a few appointments open if a walk-in were to come in, but most of the time, it's all appointment only.
Wow. And how do people learn about you normally, or how do they get more information? Is it a website they should go to?
Yeah, so we try to make ourselves pretty present in the community. So we go to a lot of events like this and try to really connect with the residents of Hamilton County. Not even people who need our services, but people who might know people that would need our services. A lot of the hospitals know about us and things along those lines. But if people want more information, we do have a website, trinityfreeclinic.org, that they can go to and they can learn all about our different specialty clinics, our services, our hours, appointments, and what they would need to bring to come and be seen at the clinic.
Wonderful, wonderful. And do you use volunteers?
Of course.
Okay, so tell me what kind of volunteer positions you're looking to fill, like right now, spring, summer, and ongoing.
So we operate with volunteers. So all of our providers are doctors, nurses, dentists, all of those, we can always use more providers. Our biggest need, I think, right now, and I would have to double check with our volunteer coordinator, but we always need interpreters. We need a lot of Spanish interpreters. About 50% of the population that we see at the clinic are Spanish speaking. So if anybody has those skills to interpret, not just Spanish, we have a lot of people from a lot of different backgrounds that come in. That's huge. We also have positions like clerks and people that kind of come in and just help organize the clinic and make sure that we are a well-oiled machine. So it ranges from the type of volunteers that we need.
Wonderful. Lots to do. And who would someone contact if they wanted to check into volunteer positions?
So if they go on our website, the trinityfreeclinic.org, they can go to volunteer opportunities and start their application there. And then our coordinator is Lisa Curry, and her email is lisa@trinityfreeclinic.org.
Awesome. And last question, how long have you been with the group?
I've only been with them since last August. So
I'm shocked.
Still very new. I'm still pretty new and I'm still learning all the ropes, but it's an amazing organization. I'm lucky to be part of it.
I can tell your passion for it, and that's wonderful. That's who needs to be there, the people that really love it and live it. So thank you for all your information.
Thank you so much for talking to me.
Take care. Good luck. I hope you get lots of people today.
Keep it down to a minute.
Oh, a minute. Keep going.
Hey, we need to interview you. Where's your other person?
Oh, we could come back.
Clear captions.
Clear captions. Hi. And your name is Stacy. Hi, Stacy.
Hi there.
Can you tell us a little bit about your Clear Captions?
Sure. Clear Captions is a federally certified provider of caption telephones to anyone who lives with hearing loss for free.
Wow. How does someone go about getting, I can see this. I don't know if we have it on camera, how great this is. So this phone is showing the conversation.
Right,
So people.
it shows what the other person says.
Wow.
It is louder than a regular phone. And this is something people have been paying for since 1934 and don't realize it. And everybody has the legal right to have a normal telephone conversation.
Wow.
And so, we give these away for free.
How does someone get in touch with you?
They call me at 317-771 8890.
Wonderful. And do you use volunteers?
No.
No volunteers needed. All right. Thank you so much. I've never heard of your group, so this is wonderful. Thank you. Watch out for that rug. There you go. Hi. Oh, Prevail. We know Prevail. And you are?
I'm Jan.
Jan, I'm Christine. It's nice.
Hi, Christine.
Nice to meet you. Yes. So can you tell the audience who is watching a little bit about Prevail?
We are advocates for victims of crime and abuse. We have different support groups. We have one-on-one meetings with advocates. We help people fill out protective orders. We do all kinds of stuff.
Yes, you do. Yes, you do. So how does someone, if they need your services, what's the best way to get a hold of you?
Call us.
Okay.
317-773-6942.
Wonderful. And volunteers, do you guys use volunteers?
Yes, all the time. We have we need administrative volunteers. We need co-facilitators for groups. We take different groups that do brochures and help us put things together. Yeah, we use all kinds of volunteers.
That's a yes. She needs volunteers.
Yes, you can donate.
Can I still do that? Okay, I wasn't sure. Now they're kind of old. So
That's okay. Okay.
Thank you, Jan. Thank you so much. Hi, guys. How are you? And your name?
My name is Becky Lawrence.
And you are with?
Life Center is also called Pregnancy Choices Indy.
Oh, wonderful.
Yes.
Tell us a little bit about your group.
Yeah, well, we're pretty much there for anyone who needs help with a free pregnancy test, sometimes ultrasounds. We also give out free baby supplies. So diapers,
Wow.
clothing, and anything else we can find for them and give to them.
Okay. My first thought is if somebody wants to donate items, I bet you really welcome donations. How does someone go about donating?
Well, they can donate to any of our 7 centers, and you can find us on the web. It's lifecenters.com, and so depending on where you live, drop it off there. But we are located in Noblesville over on Sheridan, so you can just stop by Monday through Friday and drop it off there.
And if someone needs your help, needs your services, what's the best way to start that process?
Just give us a call, schedule an appointment. We can answer any questions they have over the phone. It's that easy. All they need is a picture ID, and that's it.
And do you use volunteers? Do you need some volunteers this spring, summer, ongoing?
Yeah, right now we're pretty good on volunteer coverage, which is wonderful. We do have people who come in and they sort the baby clothing, and that's always fun. I love that. So, yeah.
Yes, wonderful. Something to keep in mind. Thank you so much. Hi. Oh, Humana, how are you?
Right, how are
Hi,
you?
Rich. I'm Christine.
Hi, nice to meet you.
Very nice to meet you, sir. So tell us a little bit about your group.
Well, Humana, we deal a lot with Medicare insurance type of plans, so typically seniors that are 65 and older. We also offer insurance for people under 65 if they're permanently disabled for 2 years. But that's our primary business. We help seniors out.
Would you call that a supplemental? Is this a supplemental?
That's a type of Medicare plan, a Medicare supplement.
Okay.
We offer those as well, Medicare Advantage plans, Medicare prescription drug plans as well.
Okay.
So we're a Fortune 100 company, and we're a national company, so we help seniors out with their health insurance.
That's wonderful. So if a senior is having trouble, what's their first step to get some help and get to learn what you guys can help them with?
Well, if someone is near 65, they usually they'll get a book, the Medicare and You Handbook. It's a great book. Explains how Medicare works. You do some research and brush up on what Medicare is all about, and then they would typically call an insurance company. There's many different insurance companies out there. We're one of them. Hopefully they call Humana, and they can call us and we can schedule an appointment and tell them what their Medicare options are, and we basically help them out and find what's the best program for them, because there are many different types of Medicare programs for them. Each person has their own needs, so we're going to try to assess what their needs are and see what the best program is for them.
To keep the costs down, that program only what they need.
Right. There are many different programs, and based on there's certain factors that you would take into consideration as far as what plans that you want. Cost is always one of those factors, but also your health situation and things like that could dictate which might be a better plan for you, and what kind of medications you're taking that will dictate what kind of drug program might be best for you. So it's probably a good idea to speak to an insurance agent and have them ask you a lot of questions, see what your needs are, and hopefully get you into the plan that's best for you.
That's wonderful. That's wonderful. So is there, when they do that, is there some type of form that's filled out that kind of checking the boxes, and then they determine which is best for them, which plan is the best?
The key is asking a lot of questions because there's no one plan that's right for everybody. You got to assess what that particular person's needs are, and then based on what those needs are, you can tell them what their different options are.
So a good interviewer, that's the important thing, having somebody asking all those important questions.
Right, because what's scary is that if you have limited information and you make choices on limited information, you might put yourself in the wrong plan. So have a licensed insurance agent speak to you. Either they can come to your house, or you can talk to them over the phone, or you can do it online, but you don't get necessarily the personal attention that you would get with a personal agent. So that's what I would recommend, to speak to an agent and just see what the needs are and see what the best plan is for them.
Yes, thank you so much for explaining that process to me. I really didn't know how that worked, so thank you.
Well, it was nice meeting you. Thank you.
Good luck today.
Well, thank you. Take care.
Thank you. Oh, St. Vincent Hospital. Hi, and you are?
Chastity Harden Glazebrookes.
Wonderful. What do you do with St. Vincent?
I'm a health advocate. What I do is help with wraparound services, help people sign up for insurance, food stamps, any type of health barriers to health.
That's called wraparound services? Okay. So additional services.
Right. Any type of barrier to health that the patient might need, whether they need help with finding a doctor, medication, signing up for insurances, signing up for food stamps. We are advocates. We try to help navigate them through the system, basically.
Wow, okay, so I didn't know that existed, and that's wonderful. How do people find you when they're in need?
We're at different St. Vincent's locations. Our department is called RUA, or Health Access. Normally, we're at the different locations throughout St. Vincent's Ministries.
Are you in the front lobby somewhere where people can see you in your shirts and know?
No. We're health advocates, are medication assistance coordinators. We're not in one distinct area within the hospital, but if you call local listings and ask for RUAH, R-U-A-H department, you can be directed to our department.
Okay, so the people that find you, are they referred to you from other areas within the hospital? Okay.
Community-based also.
Okay, wonderful. Well, that's fantastic.
Yes.
Thank you so much. So how long have you been with them?
Oh, 11 years.
Okay, I can tell. You know your stuff. Thank you. Good luck today.
Thank you.
Walk this way. We're going to skip this table because they have someone at their table right now. We'll go to you guys. So, Unique Home Solutions: windows, doors, gutters, roofs, siding, baths, kitchens, waterproofing. Hi, and you are?
Annie.
Hi, Annie.
Chrissy.
I'm Chrissy too. Well, I'm Christine, but they call me Chrissy. Like I grew up. Yeah, your family did that too, right?
Yes.
Yeah, me too. So tell us about your company. Who wants to talk? Chrissy wants to talk.
We are an employee-owned home improvement company.
Okay.
Yeah, so we like to help people age in place.
Ah, wonderful.
Yeah.
And so what kind of things? You do the ramps to the house, and then do you do outfitting for the bathrooms, the safety?
We do walk-in tubs as well as walk-in showers. Okay. Absolutely, yes.
That's wonderful. So if somebody wanted to get a hold of you guys, what's the best way? Do you like them going to your website to learn about you, or?
They can call us at 1-800-800-1971.
Wonderful. Thank you. You too. Hi. Elder Law. Wonderful. I think you guys might have been here Last year or the year before? Okay, I do remember. Wonderful. And your name?
Lisa?
Lisa, thanks for coming. So can you tell the audience who's watching a little bit about elder law, what the value is of going to an elder law attorney?
The value of an elder law attorney is everybody needs a power of attorney. It doesn't matter what your age is, because anything can happen to us at any age. And if you're laying in a hospital bed, you still need someone to pay those bills for you, and they have to have access to your accounts to be able to do that. And everybody needs a will. And if you have younger kids, you definitely need to set up that will to be able to have somebody take care of them in case something happens to you.
And not every attorney can do elder law, correct? I mean, that's a specification, correct?
Yes, every attorney can do that, but you definitely want somebody that specializes in it. That's the difference. Obviously, if you got a DUI, you wouldn't want to come to us, because we do specialize only in estate and elder law.
Yeah, that's wonderful. And you guys are downtown Carmel?
We are in Fishers on Allisonville Road.
Okay.
Right across from the airport, for people who are familiar with that area.
And if somebody wanted to, they're ready, they need an elder law attorney today, what's the best way for them to reach out to you?
To call 317-863-2030, and if they just want education, we do monthly workshops, so you can give us a call at that number and find out more about that too.
Oh, that's wonderful. I actually would love to go to that to learn more. That's wonderful. Oh, wonderful. I will take one of your postcards. That's fantastic. Thank you. Thank you for coming back. We're so excited. Thank you. And we'll go this way.
Good luck.
And we're going to pass this table because there's a client at that table. And we're going to go around this way. Here's recycled cycles. I think that's what Nancy was talking about a little bit earlier. Hello.
Hello.
Oh, chiropractor right here. They have something going on, so we'll pass on by.
Oh, well, we had to see you go on by her.
Yeah, we can come back. We're working our way back. Oh, Sokoa. Hi, welcome. And your name?
My name is Stephanie Foltz.
Hi, Stephanie. It's very nice to meet you. Sokoa is amazing. Can you, for somebody who doesn't know what Sokoa is, who's watching, can you just give them a little rundown?
Yeah, so SOCOA is what's called an Area Agency on Aging. We are a non-for-profit organization that provides in-home services to help prevent nursing facility placement. We also do home-delivered meals, transportation, caregiver supports, and community resource referrals. And we do serve Marion and the 7 surrounding counties.
Wow, that's fantastic. How do people obtain your services or contact you?
They would want to call into center, which is 317-803-6131, and we would do an over-the-phone assessment and let them know what services they might be eligible to receive.
And are people that contact you, are they normally surprised at how much they do qualify for? Things they never knew?
Yeah, and they're also very surprised that sometimes we're able to find needs that they didn't even know that they had, and we're able to provide those resources that help meet needs that they didn't even think to call us about.
Yeah, that's wonderful. And obviously you guys use volunteers a lot. Right now, do you know what your volunteer need is? If somebody's watching and is looking for a volunteer position now or in the future, what kind of things do you guys have going on?
Yeah, so we have friendly visiting. We also do, if you're not somebody that likes to meet in person, we also do telephone visiting. So you would call a client and just talk to them over the phone. We also do handyman services, yard work, and different things like that.
Okay, wow. I love the phone interaction because people who want to volunteer but don't have a set schedule, that's how I am, and I think that would be perfect because you basically tell the senior that you're going to call between 2 and 4 on a certain day. Wonderful. That's fantastic.
Yeah.
Thank you so much.
Thank you.
We'll come back to this one. Hi. Oh, Home Instead. Wonderful. And you are?
My name is Michael Bremsky. I'm the home care consultant with Home Instead.
Wonderful. Can you tell us about Home Instead? What is Home Instead?
So Home Instead is a non-medical in-home senior care company. So our goal is to allow folks to age in place and stay at home as long as possible. So we can come out and provide cooking, cleaning, bathing services, we can do laundry, we can do just basic companionship, so we can hang out with some folks and make sure that they're safe within their home. We can run errands with them. So we have a lot of the different abilities to allow them to stay where they are and not have to go into a facility or a hospital.
That's wonderful, wonderful. Is any of this covered, your services are covered by?
We do work with Socoa sometimes. We do take on waiver clients, but for the most part, we're a private pay company.
That sounds, yeah. And you're situated just in Hamilton County, or are you pretty much all over Indy?
So we do our specific office does Hamilton and Boone counties, but there are Home Insteads throughout the state. We have offices all over Indy, Evansville, Fort Wayne, pretty much anywhere. So if anyone had a need, they can call their local office and we'll put them in touch with whoever is closest to where they are. So
wonderful. And if somebody wanted to get a hold of you today and learn more about your group, what would they do? What's the best way to reach you?
So the best thing to do would be to call our office. Our office number is 317-774-1750, or they can go online to homeinstead.com. I think it's /705, which is our office number. So they can do either of those things to get a hold of us.
Awesome. Thank you so much.
Thank you very much.
Have a great day.
You too.
We're going to cross the aisle here, go this way. Work one, we're going to pass them. They have somebody at their desk. We'll come back. Don't want to interrupt you. Hi.
Hi there.
Hi. Did you say Hines? Hines Career Center. Hi, and you are?
Nancy Mitchell. Polly Redmond.
I remember you. I've met you before, maybe last year.
Speak better standing.
Yes, please stand. So can you tell the people that are watching that are unfamiliar with Hines what Hines is?
Hines Adult Ed, actually, we actually used to be known as like the GED program, and that's all we did is we helped people study for their GED if they hadn't finished high school. Now, in addition to doing the high school equivalency, which is the new name for the test, about 20% of our people are actually high school graduates who are just coming back to brush up on their math and reading skills. We're partners with Work One, and we work with them to help get people those skills before they go on into certification. A lot of people don't realize that we have companies waiting in line for welders these days. Starting wage is $14 an hour for welders, and full benefits, full time. I think the last I knew we had 9 companies waiting in line. They need to get through us to get enough math, because obviously if you're welding you need some angles.
What's the training time takes to be certified in welding?
So we do our welding certification to 14. And then if they're coming to us for their HSE, for their high school equivalency, we do that in about 6 to 8 weeks for most people. And now that's an average. We have some people who've dropped out of school at 5th grade, which is way early. And then we have some people who drop out at like 11th grade. And those people who dropped out very late in high school, sometimes they're only with us for 2 or 3 weeks. So it's a really wide distribution because we kind of try to fit it to the person who's studying. So here in Hamilton County, we're at the Noblesville Ivy Tech. We have both daytime and evening classes. We're at Westfield Middle School every Monday and Thursday evening, and we also serve both of the correctional facilities here in town with classes there. So the jail and the community corrections, so that we can get people that education as they're coming out and trying to reintegrate.
And what is the best way for someone to learn about these, ask you questions or learn about these programs?
If you just call our direct number at 765-552-4122, that comes directly to us. And if we don't answer the phone, leave a message. Nancy actually will get back to you.
Wonderful. And volunteers, do you need some volunteers currently?
We actually love having volunteers, all the way from people who have the skills to go into our class and tutor, especially with some of our students who need more one-on-one work, because 60% of our students have learning disabilities. You're actually more unusual in our classes if you don't have. But we also need people to help us with PR or grading papers, phone calls, all sorts of things. So there's a lot of things, and if you use the same number, that's 765-552-4122, or you can apply today. We've got applications with us.
Yes. Don't forget, we are here until 4 today, so these guys can answer your questions right here live. Thank you so much. Thank you.
We appreciate
yes. I always love listening to you. Hi, ladies. Oh, Little Red Door. Yes. And your names?
Tina.
Hi, Tina.
Leah.
Hi, Leah. Nice to meet you both. Would one of you who would like to tell us a little bit about Little Red Door?
So Little Red Door helps provide support services for cancer patients in the central Indiana region. So we have an office in Indianapolis that serves up here in Hamilton County. We provide anything from rides to and from treatment to medical supplies, nutritional supplements. You can see some of our wigs and door to wellness program out here that we will give for free, and all of our services are free. We also offer a camp, 3 camps for pediatric patients and patients who have kids as well.
And how does someone find out about your program, more information?
Yeah, so they can either check our website at www.littlereddoor.org, or they can give us a call, which our phone number will be on the website as well.
Fantastic. And how is your volunteer situation? Do you guys need volunteers currently?
Yeah, we always are always looking forward for volunteers. We do like one-time events throughout the year. We have some people that come in and make care packages, things like that, and they can always reach out to us through the website if they're interested.
Fantastic. Thank you so much. Thank you both. I hope you get lots of visitors today. You're wonderful. We'll go back here and go to Work One real quick. This gentleman, would you like to tell us about Work One? I think this is so great. Both of you guys are I love your groups. So I do. Tell the audience here who might not know about Work One what your group is about.
For those individuals, they know Work One, and a lot of times I'll say, do you know the unemployment office? Well, yes, but Work One is an umbrella term that's used. Our primary objective is to match job seekers with employers. My objectives as a business consultant, a services consultant, is to talk to employers, let them know what programs are available to them, incentives that are available to them as employers, but that's our ultimate objective, is to match employers with job seekers.
It's fantastic. So if somebody was looking for help finding a job, what's the best way they would get a hold of you guys?
They can contact us. We're online. Just Google Work One, it'll come up. But we have offices in every county in the state. Our office here is located at the Ivy Tech. We're in the Ivy Tech building on North 17th, I think. I conduct consulting services in Hamilton, Hancock, Shelby, and Johnson. I'm here today.
Wow!
And everybody ran away.
It's probably the camera, yeah. What about volunteers? What kind of volunteers do you need currently or in the future?
We can always use volunteers. We love for individuals to come in with different organizations to conduct workshops, maybe share a little of their purpose, the reasons they're with us, yeah.
That sounds wonderful. Would a volunteer go to the website as well?
Sure. They can come to the website, visit us, call us, email us, but we're available. We love building partnerships with fellow agencies like are here today.
Yes, it's very rewarding, I'm sure. Yes.
Putting people to work, that's our primary objective.
Yes. Okay. Everybody feels great about that. Thank you. We'll go this way. Oh, Gentle Dentist. Hi. Oh, good. I'm Christine, and you are?
I'm Kim Jackson.
Hi, Kim. Nice to meet you.
Good to meet you.
Could you tell the people who might be watching about Gentle Dentist and what you guys are about?
Sure. So Gentle Dentist, we have 12 locations throughout central Indiana. We provide family, cosmetic, and restorative dentistry to patients of all ages. We accept just about all dental insurance plans, and our Westfield location is now credentialed for Medicaid and HIP, which is great as a resource for the community. Yeah.
And how would someone find you if they needed your services?
Sure. You can visit indianagentlendentist.com to find a location near you.
Okay. If somebody right now they had some tooth pain right now, how soon could they get in to see someone?
Depending on the location, we do have several locations throughout the area open today, but most times we can get you in pretty quickly.
Fantastic. That's amazing. Okay, thank you so much.
I get confused with the camera. I'm like,
that's great. That's great. Oh, the Humane Society. We're going to pass because she has somebody at her booth right now. Hi. Neighborhood Christian Legal Clinic. Can you tell us, and I'm Christine, you're Jim.
I'm Jim.
Nice to meet you, Jim. I think we've met before. You look very familiar. Can you tell us a little bit about your group for somebody who may have never heard of you?
Absolutely. We're the Neighborhood Christian Legal Clinic. We're located in Indianapolis. We're at 3333 North Meridian Street, Suite 201. We provide free legal services. And we do this as an expression of Christ's love, but we help anyone regardless of religious beliefs or even legal status. I'm an enrolled agent. I work at the Low-Income Taxpayer Clinic, and we help people with tax problems. If you ever receive a letter from the IRS, please come see us. If you ever owe the IRS, please come see us. Let us help you. Taxes are complicated, and with the recent tax reform, that Tax Cuts and Jobs Act, they're even more complicated for some folks. So let us sit down with you. It's all free. Let us consult with you, and if need be, we can represent you before the Internal Revenue Service.
Wonderful. If somebody heard that just now, which I'm sure there is probably somebody out there who's dreading that whole tax thing and they keep putting it off, how would they contact you?
Yeah, they can do it several ways. They can give me a call, 317-429-4131, extension 167. 317-429-4131, extension 167.
Wonderful. And do you use volunteers, different attorneys or tax accountants?
We absolutely do. We utilize anyone. You can be a CPA, an attorney, an enrolled agent, or you don't. We, again, provide a variety of legal services. If you have an interest in taxation, if you're a tax preparer, for example, or you would like to learn more about taxes, we'll be happy to train you. But yes, we have attorneys, we have CPAs that assist us as volunteers, and we love having volunteers. If you're interested in other areas of the law, such as immigration or bankruptcy, foreclosure, etc., we also have opportunities there as well. So please contact us. We'd love to hear from you.
Wonderful. Thank you, Jim. Very nice to speak with you. Thank you. Hi, Janice. How are you? And you are?
Tim White, Vice President with Client Services.
Lovely. And for people who don't know much about Janice, can you just kind of give them a lay of the land?
Oh, sure. So at Janus, we support people with intellectual disabilities in a variety of ways, possibly finding a job in the community, possibly coming to our facility for the day, engaging in either, again, more work opportunities or art. We have a lot of artists that come to our place every day. And we also run a batting and golf center to the west of our property that's also open to the public. Yeah.
And where are you located?
We are on State Road 32, just leaving town as you're approaching Westfield, 1555 State Road 32. Yeah.
And if somebody wanted to, can they just stop by or should they call first?
Yeah, they're more than welcome to stop by between the hours of 8 to 4 and just ask for me, Tim White. Yeah.
Learn all about what you guys have to offer. And what about your volunteer status? Do you need volunteers right now?
Absolutely, always need volunteers for all to participate in our programs, help with work we need around the facility. We start with somebody, find out what they're passionate about, what they would like to do, give them in where they have a day that they really enjoy, and give back to Janus.
Yes.
Yeah.
Thank you. And it's Janus, not Janice. Thank you for saying that. Now it's in my head. Thank you. Hi, Chris. Good. How are you? Thank you. Hi, Cherish, Child Advocacy, Abuse Intervention and Prevention. Hi. You were going to talk, weren't you? Well, sure. So your name's Madison?
And I'm Robin Hildebrand.
Who maybe isn't familiar with what Cherish is, can you just give us a rundown?
Yeah, so we do child abuse prevention and intervention services. So we do forensic interviews when there's been an allegation of child abuse, and then we also provide therapy services for kids that come to us. We do groups in school. We have a respect group that we teach students, normally middle school age. We sometimes do high school as well, about healthy boundaries and healthy relationships and just, safe conversations that we have, and we go into schools and do that as well.
Wonderful. If somebody wanted to get a hold of you, or maybe even a teacher, wanted to have you come and speak to a grade, what's the best way to get a hold of you?
You can. That's where you You can find our phone number. Us.
And how
years now, right? Yeah. 2010.
Yeah, and what about your volunteer status? Would you like to do a shout out for any type of volunteer positions you've been looking to fill? You need help in certain areas?
Because of the confidentiality of the kids that we work with, there aren't really a lot of opportunities to volunteer. We're always looking for donations, and we do have an Amazon wish list because we like to keep teddy bears and snacks and things on hand when kids do come to our center.
Safe items that we love to take whenever they come in. So yeah.
If somebody did want to donate, who would they contact or what would they do?
And if they would go to our website, there is a tab that says donate, and it explains where your money goes and different things that you can donate.
And there should be a link as well to the wish list, I believe, that you can find on our website.
Yes.
Yeah.
It's wonderful. Thank you, ladies, so much. I hope you have lots of visitors today. Come on down. Oh, United Way, hi.
Indiana 211, we partner with United Way.
Oh, okay. Oh, wait, say that again. Hold on. For the people watching, tell us your name and about your organization.
Yeah, so my name's Alexa Hornack, and I work for Indiana 211. We are a health and human service hotline, so we help people in the state find the resources they need. All they have to do is dial 211, and we can connect them with food, shelter, health care, substance use treatment, a great deal of things. Yeah.
You're very varied help. Variety of help. Okay. And
we list what the resources that are in the state. So when people call us, they just say their zip code, and we'll tell them exactly what's there. So if they're looking for food, we'll tell them all the food pantries near them, or all the health clinics, whatever the need is.
Yeah. Do you have a local facility or outlet?
Yeah, so we have a local call center. It's in Indianapolis. It's called Connect to Help. So they take all of the local Indianapolis calls.
Okay. Okay, so not a brick and mortar. And then so 211 is part of United Way.
We partner with them.
Oh, it's a partner.
Yeah, we're a part. Yeah, so we one of our call centers actually up in Fort Wayne is a United Way 211 call center. So
okay. And does 211 need volunteers currently?
We do not.
Wow, you're the first person.
I could put people to work, but we're not actively looking for any volunteers.
That's okay. There's plenty of other groups. Next year, maybe.
We can connect people with volunteer opportunities if that's something they're looking for.
Okay.
Yeah, so it doesn't just have to be a crisis call. It can be about anything. We have universities in our system, stuff like that. Childcare. Yeah.
Well, that's wonderful. Thank you both. Thank you. Yep. Come this way. Oh, wonderful. Spoke to this lady earlier. Well, I'll come back. You have a lady. Oh, she's moving on. I didn't catch your name earlier. I'm sorry.
I'm Natalie.
Hi, Natalie. Nice to meet you. And can you tell the people watching your group and what your group is about?
Yeah, we're Alternatives Incorporated, and we help victims of domestic and sexual violence.
And are you located in Hamilton County?
We're located in Madison County, but we also have outreach services in Hamilton, Hancock, Tipton, and Elwood. So we have outreach services in many different areas.
Okay. And if somebody had need for your services, what is the best way to go about contacting you?
Yeah, you can contact us at our phone number. It's 765-643-0218.
Wonderful. And are you in need of volunteers currently?
Yes, we can always use volunteers for all sorts of things.
Okay. Anything in that you always need more help in? Is there an area where you always need volunteers?
We have volunteers that help with kids. We have volunteers that help with meals. We have volunteers that come in and help with our landscaping. So we really use everybody and anything that we can get.
Wow. So basically call and start talking to you and probably find something that fits everybody.
Yep, everybody.
Okay, wonderful. Thank you so much for coming today. Going this way. Oh yes, Plant Power. I was talking to this nice lady earlier today. She was explaining her company to me, and I'm so sorry we did not exchange your name.
Jenny Beasley.
Okay, and your company?
Juice Plus.
Okay.
I am a virtual franchise owner with the Juice Plus company.
Okay. Can you tell us? And I was saying now Juice Plus, that rang a bell. I knew that, but then the other part of the name I wasn't as familiar with.
It sounds like it's going to be a drink, but it's not. It's fruits and vegetables that have been allowed to vine ripen, and then they process out the water and the sugar, and they leave the nutrients intact. And so you're able to flood your body with 30 whole food fruits, veggies, and berries simply by swallowing a capsule or eating a chewable gummy.
Easy.
In fact, it is. Yeah. And then if you would like the protein powder, the chocolate and vanilla, which is absolutely delicious, then you're adding about 15 more plants to your body every day.
Wow.
And it's been a life changer for me.
You feel the energy difference.
Absolutely. Energy is one of the first things I experienced. I had a happier brain very quickly. I could see the reduction of inflammation in my face when you look at pictures of what I used to look like. And because I had so much more energy, I was able to lose weight. The protein powder evens the glycemic value, so I'm not starving at lunchtime, and I make better choices. And it's absolutely delicious too, by the way.
That helps a lot. Yeah. Thank you. So
I have better skin, better hair, better nails. My allergies about a year in. You get all new red blood cells every 4 months, and you get all new white blood cells every year, approximately, give or take. And I noticed that my allergies had pretty much dissipated all the way. And now I don't know when allergy season hits.
Wow.
Yeah.
That's fantastic.
Yeah.
That's wonderful. So if somebody wanted to talk to you about getting on the program, what's the best way if they're watching now to get a hold of you?
They can go to, for those I love, it's juiceplus.com. Or I suppose they could call me. 317-847-4777 is my phone number. And yeah, when you bridge your gap between what you're able to eat every day and what your body can use, miracle happens. And that's why I'm standing in front of you. I'm very passionate about it.
Wonderful. I can tell.
Yeah.
And you're very knowledgeable, so it's kind of...
And nervous, because I'm not comfortable in front of the TV, but I hope I did okay.
Oh, you're doing fantastic.
Thank you.
And I just, when you were talking earlier, it's just very...
Yeah.
It's so much in these capsules that are just amazing.
It's been around for 26 years.
I know, right?
I know. And
been a long
they've
time.
done a ton of research on it, showing I'm not crazy.
Yeah, no. Thank you so much.
You're
you did great. Okay, next year, right? We'll do it again. Oh, Prime Life Enrichment. Been in Hamilton County for a long time. Wonderful group, but she has somebody at her table, so we'll keep walking. Hi. How are you? Emily.
Yes.
I don't have my glasses on. Could you tell us about your group?
Okay, InnaCare has the SSVF grant, which is supportive services for veterans and families. We help those veterans and veteran families that are homeless or at risk of becoming homeless. If they qualify, we can help with housing assistance and wraparound services.
And what an example of a wraparound service would be?
Help them with employment, help them find jobs, help them with transportation, childcare sometimes.
So you network with other groups to find the solution?
Yes, we do.
Wonderful. And are you located in Hamilton County? Do you have a place where somebody can come into, or do you do most of the work over the phone with someone?
We actually can meet anyone at the Aspire offices. But I don't only cover Hamilton County. Myself, I cover Hamilton, Madison, and Northern Marion counties.
Wonderful. And if somebody wanted to get a hold of you, what's the best way to reach out to you?
855-896-4345. If somebody doesn't answer, leave your name, your phone number, and a brief message, and somebody get back in contact with you.
That's wonderful. And what about volunteers? Are you guys in need of any volunteers right now?
No, not volunteers.
That's wonderful. Thank you so much, Emily.
Thank you.
Have a good day. The Hope Center. He has a gentleman and a lady here, so we're going to walk on by. Same with our next booth. Hamilton County Quick Response Team. We're going to keep on walking. We're going to go this way. And we're going to go up this way. This is Aspire, but they have a whole table full of people here. Oh, we have 2 tables for Aspire. Hi, ladies. Who wants to talk? The lady standing, she's with somebody, so we'll get her as soon as she's done. This gentleman, I think he's free all of a sudden. Hi. Can we ask you about your group?
Oh, no problem.
Oh, we have the Shepherd Center too. Hi. And you are?
I'm Chris Allen. I am the Community Development Block Grant Coordinator for Hamilton County.
Well, can you tell us about your group?
Well, I work for the Noblesville Housing Authority, and basically the Community Development Block Grant Program is a program that operates out of the Housing and Urban Development Department for federal government. Every year, Hamilton County receives anywhere from $800,000 to $900,000 in federal funds from HUD. That money goes to benefit low to moderate income families through grants to different organizations, many of them which are here today. Good Samaritan Network, Trinity Free Clinic, Meals on Wheels. Many of these organizations, they apply to the grant, and those applications are reviewed and they receive this funding.
So you're getting the money from this government program to our groups in Hamilton County that need that money for work. Wonderful. And do you need volunteers in your group?
I don't need volunteers, but all of the organizations that receive our funding most definitely need volunteers. What I do need are for people to come and fill out this application. Every year we put out an application to try and help and determine what are the needs of the community. And through this application, we find out what are the needs, what are the priorities of Hamilton County. And it's the results of this survey that help determine how that funding is going to be spent for the next year. This survey is special because this is for our 5-year consolidated plan. And basically, there's over 300,000 people that live in Hamilton County. If we are lucky, we'll get back 100 surveys. So we are asking everybody to please fill out a survey so that we can find out what are the needs. I mean, do people want affordable housing? Do they want health services? Do they want services for domestic violence care? What are the needs?
If somebody is watching, where would they go online to get this survey?
This survey will be posted up on the County Commissioner's website for the Community Development Block Grant page. Okay. So you can go to the Hamilton County website under the County Commissioner's Community Development Block Grant. It'll also be posted on our Facebook page for the Noblesville Housing Authority. Okay. And we're also here live right now, today.
Until 4 o'clock.
Until 4 o'clock.
Thank you so much. You explained that really great. I really didn't know what you guys did. Now I do. Thank you.
No problem. Thank you.
Let's try the Shepherd Center. We love the Shepherd Center. Hi, ladies. And you are?
I'm Carolyn O'Mori.
Lisa Albano.
Hi, nice to meet you both. I don't know if I've met, maybe I've met you, I think.
Might have.
Yeah, I think so too. So for anyone watching who is not familiar with the Shepherd Center, which is hard to believe, but can you tell us about the
It's for seniors. Seniors here in Hamilton County. Our services are totally free, and we work with a lot of volunteers. So, for instance, a senior can come. Our main goal is to keep seniors in their home as long as possible, independently and living with dignity. Keep them safe in their home, and also remove any type of isolation piece. So every day of the week in Hamilton County, we have a social function going on called Together Today. So they can come, have community with people of their own age. They play bingo, they play euchre, they have dominoes going on, free food, lunch, breakfast, and that's the way for them to get out of their home to help reduce depression from isolation. And then we also go in their home. What is going on with them? What resources can they have that they don't even know about? And that's kind of the biggie for us. It's just what seniors don't know is available to them that's absolutely free and can help them live a more joyful life and a longer life.
Yeah, you guys are awesome. You just seem like you cover it completely. It's fantastic.
And if we don't know, we find out
Where the need is, just like Nancy. You all have really mastered that of finding out where the need is. And I know you need volunteers. So right now, what would be tell us all the volunteers that that you are looking for. But is there a special need right now? I'm gonna let Lisa tell us.
Transportation is always our biggest need. We take our clients to their doctor appointments, to run their errands, grocery shopping, pick up their prescriptions. So transportation is always our biggest need in the county. We also have an opportunity for friendly visitors, so they can go in and visit with them once a week to again battle that isolation, that they can even be a phone pal friendly visitor and any other needs that they might have in their home. We are also always looking for Together Today lead volunteers. On a day-to-day basis, our lead volunteers are instrumental in running that program, so they're there throughout the whole time, just kind of making sure our seniors don't need anything while they're there, helping with the cleanup, setup, that type of thing. So we're always looking for volunteers there as well, and sponsors for our Together Today program as well as the rest of our programs.
Lots of volunteer opportunities. And
do this without our volunteers. Yeah, no, absolutely.
So what is the best way if somebody wanted to volunteer or on the reverse, use your services, a senior or maybe a child of a senior who wanted to investigate all the great things you guys have, how would they contact you?
They can find us on our website, which is shepherdcenterofhamiltoncounty.org. Our contact numbers are on there. They can call our office and just speak with any one of us. You can direct. Yeah.
Ladies, thank you so much. Go back to Aspire. We haven't talked to Aspire yet. Oh, Aspire. So people can see your booths. Beautiful 2 tables here. Welcome. Hi. And you are?
My name's Sid Emke. I'm with Aspire Indiana Health. I'm the Chief Operating Officer for the Primary Care Department.
My microphone was too close.
Sorry
about that. So, wonderful. Can you tell anyone who is unfamiliar with Aspire what your group is about?
Sure. So we're representing today, we have behavioral health and we also have primary care services under one roof. We have that in Noblesville, Carmel, Elwood, Lebanon, Anderson, Indianapolis, and also have our HIV disease team who is part of that group. So what our goal is to have an integrated health product that anybody who walks in the door, whatever door they come into, they could maybe get behavioral health, they could maybe get infectious disease treatment, they could maybe get primary care.
Wow, wonderful. You guys really are hitting a lot of different points.
Very focused on the community and what the community needs are.
Wonderful. Yes. If somebody could use your services, what's the best way for them to get in contact with you?
Yeah, so we actually have a main number. It's
she's like, it's on this page.
The number I would probably recommend to use would be the 1-877-574-1254 number. We have a few numbers, but that's probably the best main number to see about if I needed to speak with a therapist, if I needed to see a psychiatrist, if I needed to see somebody for my blood pressure, that would be the best number to call.
Wonderful. And what about your volunteer status? What are you in need of help-wise?
For volunteers, we have volunteers that do cleanups in communities, so that's one of the things. Our infectious disease program has community volunteer cleanups where they go around and pick up any trash that's in community areas, so that's one of the ways that we could use volunteers. We also do a lot of health fairs and outreach to communities, so that might be something as well that we would be able to use a volunteer for.
Wonderful, wonderful. Same phone number if somebody wanted to volunteer. Thank you.
Yeah, this is going to be the best switchboard to get you where you need to go, right?
Okay.
Yeah.
Thank you so much. I'm glad we got to talk to you. Very busy
nice
table.
Talking to you. Thank you.
Thank you. Oh, yes.
Down your next row.
Well, I need to go to Prime Life right here. So I'm done with this row here.
Okay.
I need to go to Prime.
Keep on going. We're leaving at 2 o'clock.
I know. What time are we at?
1:15.
Okay. I'm moving. Hi.
So have you come do a video? Do we have to sign up for that?
No, you can just jump on like we're doing.
Oh, okay.
Hi. And you are, I don't have my glass, Paul Bell.
Probably the better at my booth.
Okay. Our ways. Thank you. Oh, Prime Life is busy. A great group in Hamilton County. We have not spoken to you yet. Hi, and you are.
Here.
Okay, can you tell anyone who's on for what you do?
Free mammograms, free flu shots, free counseling. The word free is not too understood anymore, but yes, we do that in Cicero.
Wonderful. And if somebody wanted to right now said, oh my gosh, I need that help, how would they contact you? What's the best way?
Well, we have a phone number. It's area code 317-984-3444. And we do have a website, Facebook, and a brochure, which I'll give everybody.
Yeah.
Okay.
Yeah, I'll take one of those.
Okay.
And what about volunteers? Are you in need of some volunteers right now?
One of our signs tries to emphasize we need volunteers. We rotate the volunteers.
What they need.
And we have an office manager and a volunteer coordinator that does all of that.
That's wonderful.
Yeah.
Wonderful. Thank you so much.
You're welcome.
Good luck today.
Thank you.
Hi, ladies. We missed you when we walked by before. And your names?
I'm Ann Skinner.
And I'm Kelly Gunn.
Hi, Kelly. Yes. Nice to meet you both. Can you tell us a little bit about your organization?
Go ahead. So, we are the Hamilton County COPE Quick Response Teams, and we respond to opioid overdoses. Within 48 to 72 hours of an overdose, our goal is to go out on a home visit and to reach the person by offering support and recovery assistance and hopefully getting them into some sort of treatment. So our teams are comprised of a law enforcement officer, a firefighter, paramedic, and then Ann is our peer recovery specialist. So she goes out on the visits.
So I'm in recovery myself, so I can go out and relate to the patients hopefully a little better than a therapist or a police officer can, and hopefully get them some help. So the idea is, did you say 48 hours? Okay, so hopefully we can, there's not been follow-up historically, so now this is a new program. So hopefully we can save some lives and get some people in some treatment.
What kind of volunteers are you in need of?
So it is not, right now we are looking for starting up some different facets of the program, would you say? And so some education, we are going to be doing some education.
In
so
schools and out in the community, and then also prevention toolkits for schools and teachers. And so we have a few people that volunteer for us that have been touched by this personally. So mothers of people that have passed away from an opioid overdose, other family members who have endured this kind of tragedy. So anybody who's interested can definitely contact us, and we can try and plug them in somewhere. Yeah.
Find a place. I'm sure there's lots of need. Thank you so much. Thank you both. Oh, and so people don't contact you directly. That's right. So you get your service known to the police and the fire departments and.
But we get our information through them. But if somebody is interested, they can contact me, and my information is on my card here. So if you guys wanted to share that, that would be fine. So.
Do you want to get the number?
Yeah. My number is 317-471-7506 for the program coordinator, and my name's Kelly Gunn.
Thank you. We're not editing anything, so I couldn't put. Normally, yeah. Thank you. Thank you so much. Hi. Hey, we've met a long time. Janet, nice to see you. This is Janet. Janet, would you like to tell us about your group?
Sure. Partnership for Healthy Hamilton County is a network of agencies and businesses and education functions who work throughout the county to improve the health of the residents. So we meet as a quarterly coalition, and we have monthly speakers and associations on ways that we can work on combined projects for health.
Wow, you say that so well. A hold of you guys, how would they contact you?
The best way to do that is we are out on Facebook, so I would say we post on Facebook a lot, and it's PHHC Hamilton County, and that's the same for our website address, www.phhc Hamilton County.
What about volunteers? What kind of volunteers are you in need of currently?
We look for volunteers that can help on days such as today, also work at some of our mobile food process. If you like to come together and put together recipes, we have lots of small projects. We're currently trying to put together a recipe book that works for seniors and works for youth, and it's just simple 3 to 5 ingredients that you can work, and so we look for people that have an interest in helping us with those different projects.
That also sounds really fun.
It is. It's a lot of fun. It's a time to get together, have a little bit of fun, and find a way and learn more about the community.
Thank you, Janet, so much. Have a good day. Nice to see you again. Going this way. This lady is with Divine Therapeutic Massage. She has a client here right now, so we'll pass her by. Won't bother her. Hi. Noble. Dream it and live it. And your names?
My name's Lisa. Deb.
Okay. And tell us a little bit about Noble.
Sure. We provide services for children and adults with intellectual and developmental disabilities. We have a variety of services, from therapies to residential services to day programming to community employment. So just a variety of services.
Wonderful. That sounds fantastic. How do people, if they want to find out more about your services, how do they locate you?
Sure. Yep, that's our intake coordinator right here.
You can contact us on our intake phone number. It's 317, I should know my own phone number, 375-4228.
You don't dial your own phone number, so it's okay.
Yep, so that's our main line for intake inquiries.
What about volunteers? Are you guys in need of volunteers right now? What kind of volunteer positions?
I think we're always in need of volunteers. I'm not 100% sure what positions we would...
But call and you'll be directed?
Yeah, and direct you to the volunteer coordinator.
We also are hiring for direct care support staff, so we're always hiring. So if anybody's interested in working with that population, individuals with disabilities, we'd be glad to have them apply. And we have our website, Noble Dream It, Live It is our website, so you can go to and apply.
Wonderful. Thank you so much. Thank you both. Walking down. This is National Youth Advocate Program. But she has somebody at her table. Hi, ladies. Your legacy keepers? Antique story and song. Oh my gosh. I'm a genealogist. Not professional, but preserving family history is my passion. Yes. Oh, I didn't know you were going to be here.
This is at
Wow. Wow. Oh my gosh.
Saturday through the school year.
Well, tell us your names and then tell the people watching. Say again. Oh, so sorry. Nobody heard that. Tell us your names and tell us about your group.
Hi, I'm Janet Gilray, and I'm with Legacy Keepers Music. And what we do is bring public music to people of all walks of life and all ages. We do the Antique Stories in Song, downtown Noblesville, through the school year. And then this is what we're excited about now, because summer is starting and our concert series has grown. There's 7 bands playing on the lawn of the courthouse from May 25th up till September the 7th. And this is Kathy Foster. She'll be helping me.
All you need to do is bring your lawn chair, come on down and join us. That's all you need.
Music. It sounds wonderful.
Well, we've been really well received, and people in the community have supported it, and the businesses provide prizes, so we've got a raffle and 7 different groups. Country, bluegrass, old time, nice selection of music that goes with the old timiness of the square. Okay.
Sure.
You come too, okay?
I will be there.
And there'll be old cars all along the square also. They bring antique cars in for those evenings.
Oh, that sounds really fun.
Like old things? Yeah. Like old people? Come on down.
Thank you both so much. That's really exciting. Thank you.
Genealogists are welcome too.
Oh yes, genealogists. We love it. And I love the downtown. It's beautiful downtown. Thank you. Thanks, ladies. so sorry. You were finishing your conversation. How are you? Good. And your name?
I'm Bonnie Wilson, and our organization is Community Action of Greater Indianapolis. We serve Boone, Hamilton, Hendricks, and Marion County, and we do Section 8 housing only in Tipton County.
Okay.
So some of our programs are, we do the Section 8 housing, and we have weatherization and home repair, and we do foster grandparents, which places seniors 55 and older in schools or daycares to help give one-on-one attention to the kids. And then the seniors earn a small stipend for doing that, a volunteer stipend. And then we have case management, which can help with paying 1 month rent or car repair, or it can help pay certification fees for people who are gaining a certification programs in Marion County, and we have a multifamily housing in Westfield. And we have other agency programs, like we have the We Can program, which is to help kids who are at risk, get stable life, or if they're already, fairly stable, it will help them to guide that career. And we have some programs for offenders who are recently released to help them. Yes.
Wonderful, wonderful. So many programs, wow. If somebody wanted to get a hold of you guys and learn about the specifics of these programs, what's the best way to start?
I would say they can look at our website, which is www.cagi-in.org. And that will explain all of our programs. They can also call our Marion County is our main office, and they can get information there by calling 317-396-1800.
Wonderful. And are you in need of volunteers currently?
In Marion County, I think that they can usually, and which Marion County would be then our coordinator, and then, with the volunteers then for the other counties, they'll coordinate that.
Okay, wonderful. And go to the same website for that?
Yes.
Okay. Thank you so much. Thank you.
You're welcome.
You're her support?
Yes.
Yeah. Hi there. And your name?
Lynn Epperson. I'm the Hamilton County Veteran Service Officer.
Oh, wonderful. Nice to meet you, Lynn. Can you tell us about what you do?
I am responsible for helping veterans and or their dependents file for their federal and state county VA benefits.
Okay.
Okay,
and so a lot of people don't probably realize you are here to help them. We need to get the word out.
Yes, a lot of people that come into my office said that they were referred by Indianapolis because they didn't know they had a close office. Okay. So we're in the Judicial Center, 1 North 8th Street, in the back of the building, in Suite 179.
And what city? Oh, in Noblesville.
Yeah. Mm-hmm.
Okay,
yep. Monday through Friday from 8 to 4:30.
Okay. So people can just stop in, or would you prefer them to call?
It's better if they call to schedule an appointment, but we do take walk-ins as in between our scheduled appointments.
Awesome. And call what phone number, or go to the website and get?
You can go to the county website under Veteran Services, or you can call 317-776-9610.
Wonderful. Wonderful. And do you need volunteers currently?
Yes, we do. We actually need a lot of volunteers. The Richard Raudebush VA Medical Center has now added Hamilton County to their volunteer transportation network. So veterans here in Hamilton County that need a ride down to Richard Raudebush, we need drivers, volunteer drivers for that. And we have information in our office for that.
Oh, that's wonderful, wonderful. Oh my gosh. So what's the criteria to become a driver?
You just contact the Richard Raudebush VA Medical Center and they'll go over what the particulars are. Mm-hmm.
Thank you so much. Thank you. We haven't talked to you yet. No, we have not. Hi. She's like, I don't know about that camera. Hi, ladies. Your names?
Nina Coley.
Beverly Landis.
Nice to meet you both. Can you tell us a little bit about your group?
Pink Ribbon Connection. We're a breast cancer support group. We work in the mid-Indiana area. We provide services for breast cancer survivors, free wigs, hats, bras, We have monthly meetings for them to come to if they would like that talk, and we usually have guest speakers that are kind of experts in the field. We get doctors and get a lot of the doctors that will come in and talk to us and answer questions and what have you. So
sounds wonderful. If somebody wanted to come to one of the meetings or any other information, what's the best way to reach you guys?
we have a, well, I'm looking for a phone number. Oh, well, here we go. They can call 317-255-PINK.
What about volunteers? Are you in need of volunteers?
Oh, we're always interested in volunteers.
What kind of volunteers do you need right now? What jobs?
Something like this. We have a training that we put them through. We also have peer counselors. These are usually breast cancer survivors that man kind of like a hotline, and these individuals can call. Usually will get newly diagnosed, and they'll help them answer any questions they might have. We try to connect them with someone that's had a similar experience. And what else?
That's great. I mean, I'm sure if they call, they can find out what else you guys need, but that's wonderful. Thank you both, ladies. Thank you. You're going to have to talk next year.
She has to take a picture for my boss.
Oh, yeah, so your mom can see you?
No, for my boss.
Oh, for your boss. Oh, good. Oh, good. So do you say it Proteus? Proteus. Say that.
Proteus.
And your name?
Hi, my name's Jeannie Gore, and I work with Proteus, and that is a program through the National Farm Worker Jobs Program. Look, I even have a yellow card right here. So a bit about what we did. Work one offices, however, our is for education or 2-year degree for that farm worker to help upgrade their skills as far as work experience or education. So right now we're pretty much partnering with our growers in the state of Indiana, as well as our nursery and greenhouses, seed companies, and our high schools to try to encourage our youth to go out there and just experience working on a farm. I mean, it's a lot of fun. So
right,
plus you get, the possibility of 2 years of free education.
That's fantastic. So if somebody was interested in the program, what is the best way they should reach you?
They can either go to the Work One office, or if they would like to come here and meet with me, I could do that. We're connected with all of our community partners, but I actually work out of the Work One office in Kokomo, but I'm also in and out of the various Work One offices in the county. There will be some type of Proteus information there, and they have my contacts. But they can even reach me. I have my information here. There's my email and my cell phone number. So you can reach me at jeanniem@proteusinc.net, or you can reach me at 765-242-3486, and that way I can see if I can help enroll someone into this great program.
Yay, thank you, Jeannie.
Thank you.
Have a wonderful day.
You too, have a good weekend.
You too. Thank you. This way. Hi. And you don't have to talk. You don't have to if you don't want to. Are you sure? Okay, no worries, no worries. Do you want to say hi? Oh, good, oh, good. This is Hamilton County Parks and Rec. Oh, okay. Well, everybody knows the Parks and Rec Department. Your name and what do you do with the group?
Yeah, my name's Haley Townsend, and I am the program assistant. I also help with the volunteer coordinator. We do lots of volunteer groups with anyone that wants to come out and help. We've got a whole list of stuff they can do.
This is your volunteer?
Yeah, just
wow.
Just the ones right now. We've got a whole bunch of them.
I don't know if you can get that. Oh, wonderful.
Yeah.
So if somebody wanted to volunteer with you guys, what's the best way to reach you?
Yeah, they can email Steve Sneath, or they can call Hamilton County Parks and they can volunteer that way. Okay. Yeah, absolutely.
That sounds wonderful. Thank you so much. I know we're all starved for spring and we're all waiting to get out into the parks. Salvation Army, hi. And well, thank you. And your name?
Joe Gorsalski.
Hi, Joe. Can you tell us a little bit? We all know about Salvation Army, but anything you want to tell us specifically about the Hamilton County?
So here in Hamilton County, our social service group primarily helps low-income people with rent and utility assistance that perhaps a circumstance, an injury on the job or in between jobs, or an extremely high Duke bill. So that's what we primarily do. And then we're well connected with all of the other agencies here in Hamilton County, and frequently we'll do referrals to or educate people about the food pantries and other programs that could benefit them and help save some money and catch up on bills.
Amazing, amazing. Another instance of networking in Hamilton County. All of these groups, you all work so amazing together. It's really inspiring.
That's correct.
What about volunteers? What kind of volunteers do you need?
Primary use of volunteers in Hamilton County pertains to our kettle campaign. So we will pass out flyers, we get it out to the trustees and out to everybody. It's an online, you sign up. It's volunteer, and then in some instances it's actually a paid position. So somebody, again, trying to catch up on some bills that would want to just or evening can do that through the kettle campaign.
It's wonderful, wonderful. Thank you so much. If somebody wanted to do that, how would they get in touch with you?
Just come to the Salvation Army website. I think the kettle campaign information is generally available in the early fall, so October, November. Yep.
And bring warm clothes. And hand warmers, yes. Thank you, Joe. Hi, Connect Hearing. How are you? And your name?
I'm Heather Shockley. How are you?
Hi, Heather. Nice to meet you. You have such a great smile.
Thank you.
Would you like to tell us about your group?
I might stand up. That's okay. Connect Hearing. We are a comprehensive hearing company. We do offer full audiology. We have audiologists. We do hearing tests, and we fit people for hearing aids.
Fantastic. And where is your location?
8202 Clear Vista Parkway. We are directly across the street from Community North Hospital.
Oh, what a great location. Great location. And what if somebody wanted to call you to make an appointment, or do you do drop-ins?
We prefer appointments, but if we have drop-in time, we will see you.
Okay. And what phone number would they call you at for an appointment?
They would call us at 317-621-5713.
Wonderful. Thank you so much. I'm actually needing to get my hearing checked. My husband tells me that. Thank you. And that's an assisted living. Miller. Maybe come back to that one. Connect Help 211. We saw you down this way, right? Yes. Are you a different group?
We work with 211, but we're Connect Help, so we're our own nonprofit organization as well. Yes.
Can you tell us your name and what you do for the group? And if you'd like to stand, it is easier, I know.
I'm Abby. I'm the call center manager at 211.
Okay.
Yeah.
And what does 211 do for the community?
So 211 is an information and referral network. We are basically your end-all be-all for nonprofit information or government information. We help people with food, housing, insurance. For Marion County, we work with the Energy Assistance Program. We also answer the National Suicide Hotline. We work with Adult Protective Services as well as domestic violence.
Wow. So you're the start. You go to you first, and you guys will direct them on.
Exactly, yeah. We're that connection. We connect help. We're the connection between the people and then the help that they need.
So what hours, I just thought about this, so that actually people do just dial 211, correct? But it is manned, the phone is manned during a certain time period.
365 days. Open all the days. We don't go home. We're here.
Oh my gosh, it's fantastic. So what about the volunteers? What kind of volunteer help do you need?
Right now we're looking for volunteers for our crisis line, so any help would be greatly appreciated. The application should be up online soon. They can go to connecttohelp.org, that would be great, or they can call 211 and they'll transfer them to one of the managers who will get them set up.
Oh my gosh, that sounds wonderful. Great group. Thank you so much. It was a pleasure talking with you. Yes. Oh, hi.
Really good.
Yes.
She asked tricky questions.
Oh, no, I didn't ask you a tricky question. I didn't think it was tricky. Hi, you are Stephanie. Hi, Stephanie. And can you tell us about your group, CapTel?
Yeah, so I'm with CapTel Outreach. It's my job to help people with hearing loss and make sure that they know they have access to caption telephone technology.
Okay.
Yeah.
So is this a free service?
It is a no-cost service for people with verified hearing loss. So it is exclusively for those with hearing loss. And it's a service provided under the Americans with Disabilities Act to ensure that people with hearing loss have equal access to telephone technology.
Fantastic. And so these different telephones basically do somewhat the same thing, right? So the conversation from the person you're talking to shows up on the screen. And that's pretty much what these do.
Yes, essentially. So for anything that somebody misses, they're able to read on the screen. We do have 4 different models available, 3 of which work with internet and telephone service. Then we do actually have a model that works without internet service, which does help us to stand out from our competition.
That's wonderful, wonderful. So how would someone get a hold of you to learn more about your group?
Yeah, so I'm Stephanie. I service all of Indiana, so anybody in this area can contact me directly. I would be glad to help as much as I can, and my phone number is area code 219-644. That might be easier for someone with hearing loss, and my email address is my initials, sm@oeius.org.
Lovely, Stephanie. Thank you so much. Very nice to meet you. Have a great weekend.
Thank you. You too.
I'm going to keep moving down. Oh, this is Senior Citizens Organization. Very nice group. They have some people at their table right now. And now we're at Anthem Blue Cross Blue Shield. Oh no, we're at Adams Insurance. I apologize. I was looking at the table. Hello. Hi. Are you representing Adams? Hi. And your name?
I'm Peg Adams. I'm Bob's wife.
Okay. Oh, yeah. Husband and wife right here.
Well, that's not Bob.
Oh, that's not Bob.
Nope, that's not Bob.
So would you like to tell us a little bit about Adams Insurance?
Sure. Bob Adams has been doing this for a number of years, and his specialty is in senior advising. He works with folks on their Medicare systems and tries to help them understand the system. And he's an independent agent, which means he can help them with any product that's out there. But that's what he does. And he's a minister at heart. He just loves to help people make sure that they've got what they need.
Sounds wonderful. I'm glad you guys got together with Good Samaritan Network.
Yes.
That's wonderful.
Oh, he loves doing this.
Yeah.
Yeah.
Yeah, that's fantastic. I'm so excited that you joined us this year. Please come back next year.
All right.
Nice to meet you.
You too.
Oh, we'll come back to you. You have somebody at your table. Hi. Hello, Bruce. We've met before last year. It's very nice to see you again.
Thank you.
Seeing people after a whole year and going, I know you.
Yeah.
So tell us a little bit about your group and what you guys do.
Well, my name is Bruce Watson, and I'm the president of the board of the Open Doors Pantry. And we're located in Westfield, Washington Township, and that's the community that we provide services to. And those are food and clothing services and referral services to other organizations in the community as well. So that's our basic operation.
Yeah, it was wonderful. And what is your volunteer situation like? What are you guys in need of help-wise right now?
Well, literally tomorrow is the postal food drive in the area here.
Right, I got the
And
bag is sitting on my counter. I need to fill it.
You need to fill it.
Yes.
Need to fill it. We wind up using about 85 to 100 volunteers tomorrow.
Wow.
To bring all of the food in, to get it pre-sorted and then somewhat further sorted from both the Carmel and the Westfield post offices. And all that food comes to us. Last year, that equated to about 130,000 pounds of food.
Wow.
So you can see we need a lot of hands.
Yes.
And we're sorting at the post offices, and then we sort when we get it to our facility, sort it down further.
Yes.
But as far as our general need for volunteers, we have such a generous community that we get so many volunteers calling us, asking to work at the pantry. that we can't even provide enough work for most of them that call.
Wow.
Which is
fantastic.
It's a great opportunity, but it's sad that we can't provide more more work. But we have work that kids can do. Just have like the little Girl Scouts, the Daisies, just called the other day, and what we like to ask for them to do is to do a little drive, maybe a little food drive in their neighborhood for the things that we provide to the kids for weekend back sacks. Or right now we're really in need of children's books. So we're asking them to go out to their families, to their friends' families, and collect children's books.
Wow.
And then come into the pantry, and then we'll either, if it's food, we'll help them sort the food so that they see the process. If it's books, we'll just bring them in and we'll get the books in the shelves and so forth, and then give them a tour and just familiarize them with what a pantry is all about.
Yeah.
Give them some education.
Yeah. How long have you been with the group?
I've been with them now, I guess if I haven't lost count, maybe about 9 years.
So what just came to my mind is I bet by now you've seen, because obviously volunteering is infectious and you start kids young, you are probably starting to see kids that started at that young Girl Scout Daisy age and now have come up and have continued volunteering because they got that spark, that bug early on.
Exactly. And we get a lot of volunteers from the high school.
Fantastic.
Just for that reason, because they've started out very young.
Key.
And they're coming up along the way. And they really are a big help in a lot of ways.
Yeah.
And of course, they all need to get their hours in.
Yes.
Their service hours.
Yes.
Which helps.
Yes.
But
that's okay.
But they love to volunteer at the pantry.
Yeah.
I mean, that's the one thing about our volunteers that we see all the time. Is once they come in and they understand what we do and how organized our particular pantry is, they just love to come back and volunteer.
It's very efficient and the value of it.
Yeah, absolutely.
Yes. Thank you so much. I could talk to you for a long time, but we have to get through everybody today.
Well, thank you for stopping.
Nice to see you. I'm going to walk around this way. Hi, and you're Bruce too. Hi Bruce, nice to meet you. I'm Christine.
Hi Christine.
And can you tell us a little bit about your group?
Okay, I'm with...
Down just a little bit further, like down there.
Oh, okay.
There you go.
Yeah, is it okay? Okay. Yes, I'm with SHIP, which is the State Health Insurance Assistance Program, and that translates to We Are Medicare. So we provide folks with help with Medicare. If they're just approaching 65, we explain how all the different plans work and how to take their benefits. And if they're already on Medicare, there are some programs for them to help them pay for some of their costs if they meet certain income requirements. But generally, we just have lots of good information. We help folks when it's open enrollment period in the fall to at their drug plans and see if they can get something less expensive. So we are your local Medicare site. We have a site at the Prime Life in Carmel and lots of other places around the city, and we're all staffed by volunteers.
Wonderful. Again, all the networking that goes on in Hamilton County is amazing.
Oh yeah, we've run across a lot of good groups here. Like for me coming here, again, we're a statewide local organization. Every state has a SHIP program, but coming here, I'm able to meet with lots of other people who want help with our program, the senior center, and just other people. So we all connect together to help folks.
If people want to reach you, what's the best way to get a hold of you?
The best way is our telephone number here, which is 800 452-4500, and that's our office, and that's here locally, so you're not reaching someplace in Washington, D.C. Without us, all you have is a telephone number and a website to Washington, D.C., but this is a local office. I always say we speak Hoosier, so we, again, you're reaching somebody local.
Yeah.
And if the folks on the phone can't help you, then they'll ask you where you live, and then we'll refer you to one of our local sites.
Wonderful. And what about, what kind of volunteer help do you need?
Oh boy, thank you for asking. Yes, we are staffed by volunteers. It takes about 4 days of training that we do via webinar, and then they donate some time, usually 4 or 5 hours a week, to a location. We're going to have a new location at Saxony Hospital, and we'll be staffing that with new volunteers. Our volunteers come from all walks of life. Lots of our volunteers have come to us because they've been helped by SHIP, and they want to pass it on. I have 2 attorneys, I have school teachers, I have social workers. We just have a lady who just retired from the VA, and she was an attorney with the VA, so we were more than happy to, have her. But if there's questions that they can't answer, we do have people on staff that can answer the questions. I've been with SHIP 2 years as a volunteer supervisor, and I have all the same volunteers that I came on with, plus lots more. People just love doing it. One of our volunteers was with us for 25 years.
Wow.
And we had one that she was a social worker in 1966 when Methodist, and I use the term Methodist on purpose, when Methodist Hospital did their first heart transplant. And she retired last year, but she was the social worker for when they did their first heart transplant. So we have lots of interesting people who really care about what's going on.
Thank you.
Yeah, you're very welcome.
So
Yeah,
much.
thank you.
Very interesting. Thank you. Hello. Hi, guys. Mended Hearts. I remember you were here last year.
Yes, I was here last year.
Yes. And
it's
you
a pleasure.
are?
I'm Marv Norman.
And this is your
Maureen Price.
And I'm kind of standing in the middle. Let me stand here and then go like this. So can you tell us about your group?
Okay, Mended Hearts is a peer-to-peer heart support group. We are about 60 or 70 years old, but we have a support between members of our group, plus we visit people in the hospital who are there for heart issues. We try to tell them what to expect, tell them to listen to their doctors, tell them if possible to get cardiac rehab support. So that's our primary mission, but we've taken on a secondary mission, and that is we are involved in trying to save lives of people before they have their heart event. So we've aligned with a group called Bolt for the Heart in Carmel, and they're working with us, very graciously working with us, and we buy this AEDs, automatic external defibrillator. We buy that from Bolt for the Heart, and then we give them to nonprofits in the Hamilton County area. When we give them to a nonprofit, we ask them to promote heart scans. Heart scans are very valuable in finding blockages in hearts. $49 at Riverview and probably most other hospitals locally. You can get it done if you have high blood pressure, high cholesterol, if you have smoked, if you have a family history. As you get older, all those factor into having possible blockages, and the heart scan is a quick way to find it. I have a picture here of my friend. I don't know if you can see the picture, but the fellow on the left was in perfect health. He had a heart scan and ended up with a triple bypass. The person on the right, he had an EKG, found blockages, and has a stent. The lady on top, she has had sudden cardiac arrest, and she's been brought back by an AED.
Wow.
So our goal is to reach out to the nonprofits, encourage them to have their people, if appropriate, have the proper testing done, and save their lives.
That's fantastic. Tell us about your volunteers.
Our volunteers are all unpaid. We work because we love people. We love to deal with people and encourage them and support them. If they're going through a heart issue, quite often we have somebody who's been there, done that.
Sure.
So we can talk to them and tell them what to expect and say, hey, I made it.
If somebody is thinking they might want to volunteer with you, what kind of experience, because you said you counsel the heart patient, what kind of experience do they need? Can they come in and be trained?
Absolutely. Training is required. We must follow all the HIPAA laws. We cannot discuss who we visit with, and we want them to recognize that everything is private, and we talk to them. We need to know how to address them in their situation. And since we've been there, it helps a lot.
Yeah.
So basically, that's what we do.
It's a fantastic group. Thank you.
Thank you very much.
Thank you so much. Thank you, Maureen. Angel's Attic. Hi, ladies. How are you? Can you tell us your name and then names, and then if one of you would like to tell us about Angel's Attic? Oh, look, she's pointing.
She's already. My name's Kim Beaver. This is Connie Thistlethwaite. And we're from Angel's Attic in Arcadia. And we are a food pantry and a clothing ministry. And we are about to do the HHELP, which is the Hamilton Heights Summer Lunch. So we're doing the Pack the Cruiser at the Noblesville Kroger on June the 1st. And all the food that gets packed in those cruisers is going to help students who don't have.
Oh, where do you guys get all your donations?
Hamilton County Harvest Food Bank is our largest food donor. And then as far as cash donations, Arcadia Christian Church, Cicero Christian Church, and the general community at large. Plus, we did a big fundraiser last week. We did a huge garage sale at Arcadia Christian Church and raised several $1,000s. So it was a great fundraiser.
Oh, fantastic. I hope you had good weather.
Actually, it was indoors, and I think the rain helped us because the Highway 38 garage sales were going on, and I think we got a little more traffic because we were indoors.
You got the cash.
Yes, I think we did.
Wonderful. What about volunteers? What kind of volunteers are you in need of right now?
Right now, we could use a few more people who are technologically savvy, who might like to learn our new software that we're going to learn about later today. We are going on, I believe, the Food Bank Manager, which is what Hamilton County Harvest uses. And so we would like somebody that would be willing to learn that software and help us out with that. We can always use people to go to our Sign Up Genius and sign up for a shift working. We use golf clickers to click off our points in the food pantry. Somebody who would just be willing to click a golf clicker and have a nice conversation with the client while they're shopping for their food. Or what Connie does, work at the front desk and greet the clients as they come in and things like that.
It has to be rewarding.
We need help with the children's ministry upstairs also to sit with our littles and maybe teach them a Bible, read them a Bible story, color with them.
And when would that be?
On either Tuesday night or Thursday night from 6 to 7.
Okay, wonderful. That might meet somebody's schedule that would work perfectly for them. Thank you, ladies.
Thank you.
I hope you get lots of visitors today.
Thank you.
Thank you. Hi. Friends Speak. Hi, your name?
Ron Hoffman. Ron Hoffman.
Thank you, Ron. And tell us about Friends Speak.
Well, it's a program we were trying to think of some way to just serve the community, and we came upon this program. It's a simple program to help people who are coming from another country who English is not their primary language. They have to be able to read and understand a little bit, but they're very self-conscious usually. So we've started this last September, and we've had people in the program from Venezuela, from Egypt, from India, Turkey. So there's just, and a lot of these people, you find their story is they're a doctor in their native land, they're an engineer, they're a bank manager, and now they're working, just in an hourly job somewhere, just trying to make the, ends meet until they can get their certification or whatever. So a lot of good people. It's been fun, but it's a good program. It's a simple program. So our church up the road here, Green Valley Church of Christ, has been doing this, and it's been good. So if you want to know more, contact the church and we can tell you more about it. So.
And what's the best phone number to do that?
The church program, well, just look up Green Valley Church of Christ and you'll be able to find our website and get a hold of us. So.
Okay, perfect. And what about volunteers? What kind of volunteers are you looking for?
Mostly just we only have room for like 10 people at a time in the slots. And so right now that's all been filled with our internal volunteers. Okay. And so if you're interested though, send me an email. Here's our email, Green Valley, gvcoc.friendspeak@gmail.com. Send me an email and we can talk and see if there's a need, and I'll put you on the list for future.
So are you in need of volunteers that speak these languages, or is that not necessary?
No, because it's supposed to help them do better with their English, right? So I've had people say, oh, I couldn't do that because I don't speak Spanish. Well, you're not supposed to speak Spanish. That's the whole point. So, yeah.
Thank you. Thank you so much. Nice speaking with you. We have equipment link. Hi. You're with the Fair Housing Center of Central Indiana. Your name?
Ruby.
Hi, Ruby. Can you tell us what you do with the group?
Sure. So I represent the Fair Housing Center of Central Indiana, and we work to eliminate housing discrimination. For instance, if someone is going to rent an apartment or buy a house, and for some reason they feel discriminated to their race, national origin, familial status, religion, disability, they can contact us and we can advocate on their behalf.
Oh, that is wonderful. I didn't know about this service. So if somebody was needing your help, how is the best way for them to reach out to you?
They can contact us via Facebook if it's easier for them, or they can call us at 317-644-0673.
Wonderful. And do you need volunteers currently?
Yes, actually we have a position we call the testers position, and in that position people help us to uncover housing discrimination. So if there is someone that is looking for kind of like a part-time job, they can contact us and we can help them with that.
That sounds wonderful. Sounds like a very rewarding volunteer role.
Yes.
Thank you so much.
Thank you.
Oh, he's on the phone. Is he getting off? Do you want me to go here first? No, that's okay. We'll go with you. Hi. Sorry, it was probably like your spouse or something, and right? Was that right? Oh, okay. You're working. Hi, and you are?
I'm Seth.
Hi, Seth.
Seth Lehman.
Hi, Seth. Nice to meet you. Can you tell us about your group?
Yeah, we're from Noblesville Baptist Church. We have two ministries that we're representing. One is a Friday night addictions ministry called Freedom That Lasts, helping individuals that are struggling with addictions. And then the other is a counseling ministry, people that are dealing with grief, depression, things like that. Free biblical counseling offered through the church through trained counselors.
Oh, so the counseling is one-on-one sessions? Okay. And the other one is Friday nights?
It's a group recovery meeting on Friday nights at 7 p.m.
Okay, good, thank you. Going to that one first, how would someone, if they wanted to go to that meeting, what's the best way to reach out to you guys?
They can go to our church website, noblesvillebaptist.org. You can find out more details about our location and time, but basically you just show up.
You could just show up.
Show up right off the street.
Did you give me your address yet?
We're on Pleasant Street, 1338 Pleasant Street.
Wonderful. And then the one-on-one sessions, counseling sessions?
Yeah, you have to go to our church website, click on the counseling page. There is a introductory form that you have to fill out that answers some basic questions, and then we schedule your first counseling appointment.
Both of those sound amazing. So are these new programs?
The counseling is new. We've been doing it for about a year. The addiction ministry, we've been doing that for probably 6-7 years.
That's fantastic. Thank you so much. What about volunteers? Do you find most of your volunteers through the church, or are you looking for outside volunteers?
Well, we'd love for outside volunteers to come to the church, and then no, they are for folks that are already part of our church.
Yes, part of
So we welcome folks to come, and down the road there'll be opportunities for them to get involved in the ministries. But these are mainly just things for the community.
Got it. Thank you so much. You explained that. I get it now. Thank you very much.
Thank you.
It's a pleasure. Thank you. Hi, White River. Oh, you have a gentleman. I'll come back.
Sorry, I'm always ready.
Oh, hi, Humana. We talked to Humana.
The best way to put it quickly.
All well has some people here. So we could talk to you. No, that's okay. I remember there's some groups that can't do that. Thank you. That's no worries. Thank you. Heart and Soul Free Clinic. I would love to speak to this lady, but she has a gentleman here, so we'll pass her by for right now. Hi, MD Wise. Hi, your name?
My name's Rachel Maxey.
Hi, Rachel. Can you tell us what MD Wise is?
MD Wise is one of the Medicaid health insurance providers in Indiana. We provide benefits for the Healthy Indiana Plan for adults 19 to 64 and Who's Your Health Wise program for children 0 to 18.
Fantastic. And where are you located?
We are locally located in Indianapolis, and we cover the whole state of Indiana.
Fantastic. If someone wanted to reach out to you for help, how would they contact you?
They can contact us at mdwise.org. Go to, and they'll be able to write online and have a customer service agent reach out to them to answer any questions that they may have.
Wonderful. Thank you so much. And do you use volunteers?
No, we just have outreach coordinators that we use that are in-house, and we go all over the state of Indiana.
Okay, so you're good on the volunteer front. Thank you so much. We're going to go back here. Hi, Heart and Soul Free Clinic. Your name?
Luann Prenjinsky.
Hi. Hi, Luann. Nice to meet you. I don't think we've met before. Could you tell anyone watching what Heart and Soul Free Clinic is about?
Okay, we are a free clinic in Westfield. We provide free medical and dental care to uninsured and underinsured residents of Hamilton County and the surrounding areas. We do physicals, immunizations, acute care. We'll do like diabetes management and blood pressure checks, and for dental we'll do fillings, extractions.
Lots.
Yeah, and we actually just recently started a mobile clinic, and so we've been going to food pantries and kind of setting up a medical clinic while people are there for their food pantry. They can also get medical care.
That's so good. You're going to them instead of waiting for them to call you. Yeah. That is so smart. That's wonderful. And what about if somebody wants to get a hold of you, where would they contact you? Do they call?
Yeah, they could just call our clinic. It's the Heart and Soul Clinic, 317-804-5782.
Wonderful. And what about volunteers? Are you in need of any volunteers currently?
Yes, we very much are. All of our clinics are fully staffed by volunteers. So we need doctors, nurses, administrative people, dentists, dental hygienists, dental assistants, people on our guild. So yeah, we definitely could use volunteers.
More volunteers, the more you can grow.
Yeah, and you could just go on our website, www.heartandsoulclinic.org, and there's a volunteer tab there that you could just fill out the information, and then we could follow up.
Wonderful. Thank you so much for telling us about your group. Happy Friday. Oh, hello, Linda. Nice to see you.
It's good to see you again.
Hug. Nice to see you. I saw you unloading your stuff earlier today, and I knew it was you. This is Linda. What is your last name?
Withrow.
Withrow. And she's with Coats. Is it? I always want to say Coats for Kids.
I know everybody wants to say that.
Kids Coats.
That's right. And so that's the one thing I want you guys to remember is that we are not exactly the same as Bob Gregory. So Hamilton County Kids Coats is here specifically in Hamilton County, and we do things a little bit differently. We take the coats to where people are. People make appointments. There is no waiting in line. That doesn't happen. You look at your schedule, you look at where the coats are being given out, you find what works for your family, and then you all show up and pick out your coat, including parents. It's not just for their kids.
Oh, wonderful.
Grandparents. If you don't have any kids, you can still come. It's okay.
Yeah. Hats and mittens too?
Yep. And snow pants, boots. We partner with Changing Footprints, and they bring their winter boots and set up shop, and people get to try on boots. And
Are you still located over what's that? The road behind Range Line.
Oh yes, on 3rd Avenue. That's where our warehouse is, but we're actively looking for new warehouse space.
How exciting.
Yep, we are there.
Tell us about your volunteer needs. What do you need help with volunteer-wise, or are you pretty good?
No, gosh, no. Are you kidding me? So we give out coats. I don't know if you guys can pan over to this, but we give out coats all over the county, and so we have opportunities to volunteer in every location in Hamilton County, and that's in November at our giveaway times, but it's a year-round organization. We've got coats to collect, we've got coats to sort, or not even coats. I say the word coats, but it's really donations. And so if you like to be around people, if you have a youth group, we have a great opportunity. This is not like painting a house. It's so technical, and if you mess it up, it's a bad thing. It's really pretty simple and a lot of fun, and we put on some music and talk about how you can help A great way to get connected is to go to our website, kidscoats.org, and on there it has there's a thing you can click that says collect coats, and provide all the materials you would need to go do a neighborhood coat collection, or one at your work, or one at your school, and you can customize the flyers to fit you and put your information in there. And so we just try to make it easy and fun.
Creative ways.
Yeah, exactly. Yeah. Because it is. I mean, the coat may be old to you, but it's new to somebody in November. And that's the other thing that I'd like to point out, is that we really don't want people to go shopping for us at Goodwill, because Goodwill is one of our partners, and really we're looking for just you to recycle your old coat. And we take coats from tiny babies all the way up to adult sizes 5XL. And so we could use your older coat as long as it's in good condition and you've donated it clean.
Wonderful. So you gave the website. Do you guys give out a phone number or just go to the website?
Oh, both. The phone number is also 317-324-8818.
Linda, thank you so much. It's very nice. I'll see you in another year.
Yes, I really appreciate you
Maybe
guys.
I'll see you sooner.
Well,
hopefully.
I love it that y'all come, so thank you so
much. Yes.
Yeah.
We'll go this way. What's our time? 10? Oh, wonderful. Oh, we're going a little long. Okay, I'll come back to them. Hi, I'm Christine. What's your name?
Christine, I'm Camille with Big Brothers Big Sisters of Central Indiana.
Nice to meet you.
Nice to meet you.
Can you tell us, we all know Big Brothers and Big Sisters, but tell us a little bit about this Central Indiana chapter.
Absolutely. So annually we serve 1,300 kids in Hamilton, Marion, and Johnson County. So yeah, we have a huge growth, but we always need more mentors. So every child deserves, a trusted adult in their corner, just cheering them on, because they need somebody to defend the potential that's in every child.
That is a really good point. So if somebody is out there saying, I don't know what kind of time commitment it takes, or do I have the right skills, what would you say to that person?
Absolutely. Everybody has that talent that they can share, as long as they're 19 or older and can spend 2 to 4 times a month with a young person. So it's a couple hours each time for at least a year.
Okay, wonderful. And I know I've driven by the club in Zionsville and Noblesville.
Sure. So Big Brothers Big Sisters, we have our headquarters downtown Indianapolis, and then all of our programming happens out in the community. So a mentor would go to a child's home, pick them up, go do something fun for a few hours, drop them back off at home.
So these centers are in basically each city?
Well, you might be thinking of the Boys and Girls Club.
Oh, I am so sorry. Oh boy, I'm embarrassed. Yes, that's exactly.
They get the same thing for us. No, but Big Brothers Big Sisters.
Yes, I forgot. Yes. So, I know, the mentoring program. Yes, thank you for reminding me, as I just forgot that. Thank you so much. We have a chiropractor right here, but he has a client with him right now. So we'll go around the corner here. We're going to hit some people that we missed before. We did these guys. Hi, would you like to tell us about you? You can't. It's okay, we understand. No worries. Hi, ladies. Yes, good. Can you tell us your names and then tell us about your group, whoever would like to tell us?
Ann, and my name is Katie, and we're with National Youth Advocate Program.
Wonderful. And what does your group do?
We license foster homes and place children through DCS, and we also do home-based services like supervised visitation and things like that.
Oh my gosh, have you been around in this area? Is this a local organization, or?
We are in 8 states, but we've been around for 40 years. But Anderson and Indianapolis are 2 of the older offices.
Wonderful. So you've been here for a while. Have you been in partnership with Good Samaritan for a long time?
Not that I'm aware of, to be honest with you, but we've been here to the fair several years. Yeah.
Okay. And if somebody wanted to get a hold of your group, I see a phone number and
877. Yep.
I don't know my own. Oh, I could say it. 877-692-7226. And what about your volunteer need right now? Do you guys have a specific volunteer need that you'd like to let people know about?
We really don't have a lot of volunteers because you have to have background checks and things like that in order to, but if you want to become a licensed foster parent, we'd love to meet with you.
Okay. And the same contact.
Yes, absolutely. Just ask for Anderson.
And I'd just like to say the need for foster homes in Indiana continues to grow, and there's children from 0 to over 18 that are need for nurturing safe homes. Ann and I have both had the privilege of being foster parents. She's adopted 2 girls, I've adopted 3 boys. So there's a lot of opportunity and need out there for anybody who has a heart for kiddos. So I'd just like to really put that out there. We have a lot of passion for this.
Yes, I can.
It's a calling, and I think once people see the need and meet the children, they realize they're children like anybody else, and they just need someone to pay attention and care for them. So.
Thank you. Thank you very much for saying that.
Yes, thank you. I appreciate any word that gets out there.
State of Indiana. 17,000 foster children in the state of Indiana. So, and we have offices all over the state too. So.
Wow, it's amazing.
Every day, hundreds of calls for children from 0 to over 18 in need of a place to live. And if there are no homes, they go to shelters.
Oh my gosh, thank you so much. Thank you. Thank you, everyone. That's it. We're out of time. Thank you for spending this time with us at the Good Samaritan every year this time, and we're here until 4 o'clock today. So if you still have some time, you do still have some time to come down here. We're at the Hamilton County Fairgrounds building. Thank you so much for watching.